Good.
Go ahead.
Hello and welcome. Today's presentation is an overview from the Interprofessional Collaborative Resources Committee, also known as the ICRC. Closed captioning is available and a full transcript can be made available upon request. Please email KORYANTONACI@gmail.com, Corey Antonacci at gmail.com to request the transcript. Today's presentation contains no video or images. Only text will be read and discussed. I'd like to take a moment to acknowledge Caitlin Hebb of the New England region, who sits on our committee, Amanda Sayre from the Southwestern region, who sits on our committee, and our newest member, Laurie Keogh from the Mid-Atlantic region. They are unable to join us today, but we appreciate and acknowledge all of their hard work within the ICRC committee.
This presentation is being recorded through Eastern Michigan University in Ypsilanti, Michigan, from the lands of the Anishinaabe, including Odawa, Ojibwe, and Potawatomi, and Wyandot. We further acknowledge that our university stands, like almost all property in the United States, on lands obtained generally in unconscionable ways from indigenous peoples. Eastern Michigan University has benefited and continues to benefit from access to land originally gained through the exploitation of others. Knowing where we live and work does not change the past, yet thoroughly understanding the ongoing consequences of this past can empower us in our research, teaching, and community service to create a future that supports justice for all individuals. I am Laura Powick, she, her. My privilege comes from being a heterosexual, cisgendered woman. I am able-bodied and neurotypical. My privilege is also marked by being a white, married, middle-class citizen of the United States whose education has been accessible and affordable. I'm an assistant professor of music therapy at Eastern Michigan University, and I'm delighted to have been a part of this committee for nearly a year now.
Thank you, Laura. I am Corey Antonacci, she, her, hers. I am living and practicing in Pittsburgh, Pennsylvania. I acknowledge that this practice is being done on the ancestral land of the Adena culture, the Hopewell culture, and the Monongahela peoples. Today, I am wearing a black shirt. I have long, dark brown hair, and I'm sitting for this presentation. My places of privilege in being a white cisgender woman, citizen of the United States, neurotypical, able-bodied, and having access to education are all things that have shaped my experience and my story. I am striving to learn more each day and improve wherever and whenever I can to become more aware of where I come from and where I'm going. I'm a board certified music therapist and licensed professional counselor in the state of Pennsylvania. I currently maintain a private practice, and my full-time work can be found at UPMC Children's Hospital of Pittsburgh, where I oversee the Creative and Expressive Arts Therapies program. I'm delighted to be the chair of the ICRC committee and have been in this position for over a year.
Hello, my name is Vienna Sa, she, her, and I have long brown hair and a low bun with glasses. I also am wearing a collared houndstooth shirt. I am a professor at the University of the Pacific and Delta College in Stockton, California. I acknowledge that this area exists on Native territory and homelands of the Yilkis and Plains Miwok peoples. I'm an Asian, cisgender, queer woman who is able-bodied and neurotypical. I represent the Western region and have been part of this committee since 2019.
Hi, my name is Faith Halverson Ramos, she, her, hers, and I am living and practicing in Longmont, Colorado, where 40 to 50 different Native American tribes have historically called home, most recently the Cheyenne and Arapaho. I'm dually credentialed as a licensed professional counselor and board-certified music therapist with a private practice specializing in mental health with people throughout the lifespan, and I'm also involved with the online conference for music therapy. As a Midwestern regional representative to the ICRC since 2015-2016, I identify as heterosexual. As a person, I hold places of privilege by being a white, able-bodied, cisgender woman and citizen of the U.S. Coming from a working middle-class background with an undiagnosed flavor of neurodivergence, I recognize that I've been fortunate to have access to higher education, including undergraduate and graduate training. At the time of this recording, I'm wearing a black shirt with a teal scarf. I wear glasses and have shoulder-length blondish brown hair.
Hello, everybody. My name is Sarah Breifvogel. I'm a board-certified music therapist representing the Southeastern region. I identify as she, her. I'm cisgender, heterosexual, Caucasian, and middle class. I'm able-bodied. Today, I have long brown hair and I'm wearing a dark shirt. And I've been a part of this committee since 2017, and I work in behavioral health. And I do acknowledge that my practice is done on the land of the Muskogee and Creek Indians, as well as the Cherokee peoples.
All right, just to begin here, we wanted to give you a brief overview of the ICRC's goals. So our main goals right now within our committee of AMTA is to interpret the music therapy profession to others, to professionals, disciplines, and different organizations throughout the United States. We want people to understand what music therapy is, what we do, the people we serve, and how we serve them. Our other goal is to interpret the attitudes and opinions of these groups toward the music therapy profession and its services. And later on in this presentation, you'll hear more about our large task of doing the fact sheets and also talking about music therapy and funding sources. So you'll see why the interpretation of attitudes and opinions of these groups are something that is at the forefront of our goals. And lastly, we work to identify, encourage, maintain, and make recommendations regarding different relationships between AMTA and other professional organizations, which we certainly will go into greater detail about as we go on here with our presentation.
So with workforce retention and our interdisciplinary relationships, one of our committee's directives is to support workforce retention and those relationships. Some tasks that we had and have currently that go to promote that and support that are the fact sheets that we have. They're not meant only for professionals in our field for the use of advocacy, but also for other professions like SLP, PTs, OTs, and etc. to refer to for questions about co-treatment and collaboration. The next task that we have is spotlights. So the spotlights look to show the experience of music therapists and process of music therapists with different populations. So this might also inform other disciplines about what music therapy might look like with their particular population. And then we also have national conference. So for national conference, it's not only open to just professionals and students from music therapy, but it also invites and encourages participation from a whole slew and a list that you can see here. So physical therapists, SLPs, all the way to physicians, nurses, child life specialists, all are invited. Some future aims that we have are some possible collaboration with the Workforce and Retention Committee to further those aims with specifically workforce retention. Also, some future aims that we have are spotlighting possibly co-treatment and what that might look like. So other professions might also see, what does that collaboration look like? How might it work with a music therapist? And also finally, and creating new directives to achieve interdisciplinary relationships. How else can we further develop those relationships with other professions?
All right. Thank you so much, Vienna. To further discuss our collaboration and communication with the American Music Therapy Association. So this is something that we have been working on exclusively in the past year, is to gain a better process to really ensure our fact sheets have a nice, smooth, orderly conduct that allows us to be able to make sure that everybody who sees the fact sheets needs to, and there's almost a checkpoint before it gets all the way to the national office. So the DEI committee has full access now to our fact sheets once they're reviewed, and they're ready to be reviewed by the DEI before sending them to AMTA. We've created an online filing sharing system using Google Drive, and this has really helped to simplify the process and allow for quicker access to the fact sheets. So our tag work groups people, each person who's working on a specific fact sheet, of course, the ICRC committee, the national office, as well as the DEI committee all have access to the Google Drive, the shared drive, in order to see what's ready for review, what needs to be reviewed by DEI, the recommendations by DEI, and then, of course, the final drafts before going to the national office. So when a fact sheet draft is ready for review by DEI, our council coordinator and myself email the chair to alert them that the fact sheet has been placed in the folder and it's ready for review. Then the AMTA executive board will receive the fact sheet for review before publication to the AMTA website. Our council coordinator really plays a vital role in our work, not only as a committee, but especially with the fact sheet. And they act as the liaison between our committee, the ICRC, and the AMTA board of directors for any types of tasks, information, and future tasks coming down the pipeline. And we have a really, really wonderful council coordinator, Natalie Kirk, and she has been such an asset to helping us move a lot of our tasks into motion and providing key communication between the national office, board of directors, and ourselves.
So now that you know a little bit more about how our fact sheets get communicated between the different committees and national office, I want to share a little bit about the process of creating the fact sheets, because it's been a long time in process. The ICRC has been working on these fact sheets since about 2015, when as a response to the music therapy research in 2025 that was held in 2015, and the AMTA strategic priority of music therapy in autism spectrum disorders, it was realized that we really needed to update our fact sheets, because previously our most recent fact sheet up until that point was a pain in music therapy fact sheet that had been updated in 2010. Prior to that, all of our other fact sheets were from 2006. So after our music therapy and autism spectrum disorder fact sheet got updated in 2015, the board asked the ICRC to come up with some new fact sheets that would be in a different format than our previous fact sheets that were quite text dense and had outdated research listed on it. So the committee in 2015 identified a long list of different clinical settings that music therapists work in, and started brainstorming about who might be some professionals that we could collaborate with on these fact sheets, ranging from music therapy business owners, researchers, academics, really wanting to get a wide perspective on music therapy practice in these settings. And some of the areas that we had discussed were doing a fact sheet on acquired brain injury, addictions, adult behavioral health, adult medicine, birthing, child-adolescent behavioral health, corrections and forensics, early childhood, hospice, intellectual disabilities and developmental disabilities, music therapy and trauma, NICU, older adults, pain management, pediatric medicine, special education, veterans and military, and wellness. But then after presenting the board with our long list of possible fact sheets, that got narrowed down, and we were later tasked to create fact sheets around ABI, addictions, adult behavioral health, child and adolescent behavioral health, NICU, hospice, dementia, special education, and music therapy and neurodegenerative disorders. And from that, we then sent out email invites to people that we had identified as experts in this profession to see if they'd be willing to collaborate with us on the process. In the next slide, Sarah will talk a bit more about this process.
All right. So the process of creating the fact sheets. So the ICRC began conducting lit reviews on the assigned fact sheet settings while waiting to hear back from potential collaborators and continuing to identify experts in those settings. The committee also researched the comparable fact sheets of other allied healthcare professions and developed an outline format for the fact sheets. So the goal was to make the fact sheets less text dense and easier for the diverse audiences to read. And in order to reduce implicit bias, it was decided that drafts be reviewed by the DEI committee as a stakeholder if possible. Continuing with the fact sheet process, once the working groups were identified for the assigned fact sheets, members of the ICRC helped to collect information, refine and edit the fact sheet draft, and share it with the DEI committee. And finally, the final copies with the edits based on the feedback provided by the DEI committee were then shared with the AMTA National Office, who then will take care of formatting and the graphic design of these fact sheets.
So you may be wondering, where are we at in terms of our fact sheets? So the fact sheets that have been updated and approved and updated are music therapy and child and adolescent behavioral health, and music therapy in pediatric medicine and NICU. The fact sheets that we're still waiting for final approval and or publication from National Office include music therapy for pain management, music therapy with acquired brain injury, music therapy for adults with mental health conditions and chemical substance abuse dependency conditions, music therapy in special education, music therapy in addiction treatment, music therapy in degenerative disorders, hospice, and music therapy with military and veterans. And so hopefully those will be up and available for members soon.
All right. Thank you so much, Sarah and Faith, for that wonderful overview of our fact sheet process in more depth. When we think about our original goals of the ICRC committee and being able to interpret the profession as a key area goal for this group, we really wanted to dive a little deeper in about interpreting music therapy for healthcare administrators. So something that we found interesting that we wanted to get some more information on is thinking about methods of funding. How are music therapists paid? How are these positions paid for throughout our country and beyond? And as we know, we can see a music therapist or music therapy position being facility funded, perhaps through reimbursement or philanthropy and grant funded. So we also think about matching grants, and this certainly ties in with the philanthropy piece as well as endowing programs. So one of the things that I was able to pull from our 2020 music therapy AMTA data was the breakdown. I was interested to see what is kind of the overall demographics of how music therapists are being paid at the moment. And it was interesting to me that 19% of music therapists are facility or hospital budget. 19% are paid by third-party reimbursement, which we know some of these individuals can be paid through Medicare, Medicaid, or just private insurance. Now that certainly depends on the state, and there's a lot of factors. That's not widespread everywhere, but it's something that can be done. 18% are private pay. 13% come through grant funding, 12% are government funded, and 4% are endowments. So when we think about the piece of endowment, we know that this is something where it's a large enough grant that creates a spinoff that essentially protects the position for longevity for long periods of time. So some hospital programs will do a match where the facility or the hospital pays for a certain portion and it's matched by a grant, which of course ensures more longevity for the programs. So these are an array of ways that music therapists and music therapy positions are currently being funded. So when we think about our resources like the fact sheets, these are something that we take very seriously, and we want to make sure we're providing the best condensed information to get out to our stakeholders.
In order to provide support to music therapists and other people who are involved in our work, we're going to start a music therapy spotlight. And the purpose of the music therapy spotlight is to leverage social media for music therapists and healthcare providers so that we can reach a broader audience. Those audience members may be the general public, healthcare professionals, managers, administrators, development execs, donors, and administrators. Not only will it reach a broad-reaching audience, but it will also introduce people potentially to the American Music Therapy Association website, because there will be a link that will be posted on the spotlights. Our vision for the spotlight is part one is a video of 3 to 4 minutes, maybe 2 to 4 minutes that really feature the client-therapist relationship and or interdisciplinary collaboration. Along with that would be a brief description of what people are watching, as well as a link to the AMTA website. The part two of this is the longer version. So the entire story about the client and the work that we're doing would be posted. We're thinking 250 to 300 words, and it would again be posted on the AMTA website. Those who are interested in the possibility of submitting something, just be aware that the AMTA's release of information, permission to utilize video, audio recording, photo, or story must be completed, that the video be 2 to 4 minutes, a brief description, 50 words or less, that would be for the actual social media part, and then a longer description. And if you would like any more information about this, please feel free to contact me or Corey, and both of our email addresses are there. Mine is lpawuk@emich.edu, and Corey's is koryantonacci@gmail.com. Corey, I wonder if you'd like to end for us, being that you're the leader of our group.
Certainly. We thank you so much for your time and helping us to further spread the word of what we're doing here through the ICRC committee with AMTA. And we look forward to be able to sharing the published fact sheets with you soon, and the next generation of what we will come to do, and certainly lots of great things out there to spread the word of what the music therapy profession is, how to better interpret it to other professions, and what we can do to spearhead the work within AMTA. So we thank you for your time today. And should you have any questions at all, please don't hesitate to reach out. Again, my email is koryantonacci@gmail.com. That's KORYANTONACCI@gmail.com. We certainly welcome any feedback, questions that you may have, and we thank you very much for your time today.